The next speaker is Dr. Aswin, who will be speaking on outcomes of cataract surgery in a pediatric myopic population. Dr. Aswin, over to you.
Good evening, everyone. I'll be speaking about the outcome of cataract surgery in pediatric myopes. As we all know, cataract in the pediatric population is a significant cause of visual mobility after refractive error. It has a myriad of causes, including hereditary, idiopathic, as part of multisystem disorders and metabolic syndromes. While surgically treatable, final visual outcome depends on many factors. Phacoemulsification with IOL implantation with or without primary posterior capsulorhexis and anterior vitrectomy has become the norm. However, outcome depends on the age of intervention. There is a difficulty in IOL power calculation owing to the rapid change in axial length and low scleral rigidity and elasticity of lens capsule, posing challenges to the technique and high chance of postoperative inflammation. Keeping all this in mind, our aim was to analyze the visual outcome and complications in myopic children, specifically those with axial length greater than 24 mm undergoing cataract surgery in the age group of 6 to 12 years. The axial length of 24 mm was chosen because it was 2 standard deviation above what was norm for this age group. It was a retrospective study between January 2013 to February 2023 with the age group of 6 to 12 years and having minimal axial length of 24 mm and those having a minimum of 1 year follow-up. The exclusion criteria include all those who had undergone previous ocular surgeries, those having traumatic cataract or developmental anomalies, pre-existing ocular and systemic diseases, or those with incomplete medical records. Data analyzed included age, sex, laterality, axial length, visual acuity pre-op and at 1 year, refraction and the complications. Looking at the results, we had 56 children and with 88 eyes. Males were predominant with 79.5% of the population. Mean age was 8.27 years and the mean axial length was 25.36 mm. 26.1% of the population underwent lens aspiration with IOL, while the remaining had PPC and anterior vitrectomy done along with it. The mean IOL power was 13.75, and we found a positive correlation between axial length and IOL power. The mean target refraction was 1.11 diopters. Mean follow-up was 2.64 years. Looking at the mean pre-op visual acuity in logMAR units, it was 0.89 plus or minus 0.45, which improved to 0.35 plus or minus 0.21 at GA and to 0.28 plus or minus 0.24 at 1 year follow-up. Again, categorizing visual acuity with those having greater than 6 by 18 to 6 by 60 and those with less than 6 by 60, we can see that the visual acuity improved significantly compared to pre-op and final VA, with 11.4% having visual acuity greater than 6.8 pre-op, increasing to 93.20% at final follow-up. The spherical equivalent at glass appointment was 4.7 plus or minus 1.10 and at 1 year was 0.12 plus or minus 1.39, owing to a myopic shift of minus 0.35 plus or minus 1.09. However, there was no correlation between axial length and myopic shift, which was significant. The target refraction was 1.19 plus or minus 1.15, the mean value, and the sphere at follow-up at 1 year was 0.75 diopters. Looking at the complications, 3.4% or 3 eyes had glaucoma. One was a case of bilateral cataract and the onset was at 8 years. Both the cases or all the 3 eyes were managed with anti-glaucoma medication, betaxolol. Retinal detachment was seen in one eye. The onset was 3 months after surgery, and that eye underwent vitrectomy with buccal banding and silicone oil implantation, and in final check had a visual acuity of 6 by 18. And posterior capsular opacification was noted in 4 eyes. These were 4 eyes of bilateral cataract, one at 8 months and the other at 1 year. All 4 eyes underwent YAG capsulotomy and had good vision post-procedure. Looking at a brief literature review, Chu et al. In 2019 looked at the outcome of cataract surgery in those under the age of 12 years and had a good visual outcome in 58.6% of the population. They noted that longer axial length had a better visual outcome. Al-Sub et al. In 2022 looked at outcome of cataract surgery in 1 to 5 year age group and noted that congenital cataract surgery showed significant IOP spike in follow-up. And Gogate et al. Looked at the outcomes of bilateral congenital and developmental cataract in those under less than 16 years and noted that developmental cataract, use of phacoemulsification, older children and those with better preoperative vision had better long-term outcomes. Balekutru et al. In their study of those with less than 12 years noted that younger age at the time of surgery was an identifiable risk factor for glaucoma, and Agakar et al. In the study of those with under less than 16 years noted that 5.5% risk for RD is estimated for the first 10 years after cataract surgery, increased risk in male, myope and intellectually disabled child. However, none specifically looked at studies with myopic axial length. Our study showed a significant improvement in visual acuity in cases of pediatric cataract with axial length greater than 24 millimeter. The small sample size and the short duration of follow-up was a limitation in our study. However, it still highlights the use of appropriate technology and timely intervention in improving visual functions. These are my references. Thank you.
Okay. Okay, you said you have a pediatric cataract and myopia. What was an average refractive error or myopia you are having in all of your patients?
That was the thing. It was not possible to preoperatively assess the refractive
On the
errors.
basis of the axial length?
Just the axial length.
Yeah.
It was 25.36 was the mean axial length of the population that we studied.
So the mean IOL power was 13.
Yes,
13, yeah.
What was the age group?
6 to 12 years.
6 to 12 years, so all were left with no PPC. All with PC intact?
No,
All of them?
26.1 percentage without PPC, and the remaining population had PPC and anterior vitrectomy done.
Okay. The RD, does it have anything to do with whether you did PPC or not?
The retinal detachment. It happened in the case with the PPC, ma'am.
With PPC?
Yes.